Dulcolax Suppository, Rectal is used to treat constipation. It contains bisacodyl, which is a stimulant laxative that works by increasing the amount of fluid and salts in the intestines. This usually results in a bowel movement within 15 to 60 minutes. The normal frequency of bowel movements varies from once daily to 1 to 2 times weekly. It is best to treat constipation by drinking plenty of fluids, eating foods high in fiber, and exercising regularly. This product is not recommended for use in children younger than 6 years unless directed by a doctor. When using Dulcolax Suppository, Rectal, it is important to follow the directions carefully. Make sure to wash your hands before and after using the product. You can moisten the suppository with lukewarm water, but do not use petroleum jelly or mineral oil as this can make the product less effective. To insert the suppository, lie on your left side with your right knee slightly bent. Gently insert the suppository, pointed end first, toward the navel and well up into the rectum. It's recommended to stay in this position for 15 to 20 minutes until you feel a strong urge to have a bowel movement. Using this product too often can cause a loss of normal bowel function and create a dependence on laxatives. If you experience symptoms of overuse such as diarrhea, abdominal pain, decreased weight, or weakness, it's important to contact your doctor promptly. Additionally, if you do not have a bowel movement after using this product or if you have any concerns about your health, consult your doctor as soon as possible. Remember, this product is for rectal use only and should be used as directed by your doctor. If you experience rectal irritation, burning, itching, mild abdominal discomfort, cramps, or nausea while using Dulcolax Suppository, Rectal, inform your doctor or pharmacist immediately. Your doctor has determined that the benefits of using this product outweigh the potential side effects. Most people using this product do not experience serious side effects. However, if you have persistent diarrhea, rectal bleeding, or blisters, notify your doctor right away. Continued diarrhea may lead to dehydration. Seek medical attention if you notice signs of dehydration such as decreased urination, dry mouth, increased thirst, lack of tears, dizziness, lightheadedness, or pale, wrinkled skin. Although rare, a serious allergic reaction to this drug may occur. Seek immediate medical help if you experience symptoms such as rash, itching, swelling, particularly of the face, tongue, or throat, severe dizziness, or difficulty breathing. This is not an exhaustive list of possible side effects. If you notice any other effects, contact your doctor or pharmacist. Please consult your doctor for medical advice about side effects and report any side effects to the appropriate regulatory agency in your country. Before using Dulcolax Rectal Suppository, make sure to inform your doctor or pharmacist if you have any allergies or if you have a history of certain medical conditions such as bowel problems, rectal bleeding, or stomach/abdominal symptoms. It's important to consult your doctor before using this product if you have experienced sudden changes in bowel habits lasting more than 2 weeks, or if you need to use a laxative for more than 1 week, as these could be signs of a serious medical problem. If you are pregnant, this product may be used during labor and delivery to clean the bowels before the pushing phase, but should only be used when clearly needed at other times during pregnancy. It's important to discuss the risks and benefits with your doctor. Additionally, consult your doctor before using this product if you are breastfeeding, as it is unknown whether this drug passes into breast milk. When using Dulcolax Suppository, Rectal, it is important to be aware of any potential drug interactions that may affect how the medication works or increase the risk of serious side effects. It is recommended to keep a list of all the products you use, including prescription/non-prescription drugs and herbal products, and share it with your doctor and pharmacist. It is important not to start, stop, or change the dosage of any medicines without your doctor's approval. Some products that may interact with Dulcolax Suppository, Rectal include other laxatives such as castor oil, stool softeners, and lubricants like mineral oil. Always consult with your healthcare provider before taking this medication to ensure its safety and effectiveness for you. If this medicine is swallowed, it can be harmful. If someone takes too much and experiences serious symptoms like passing out or having trouble breathing, it's important to call for emergency help right away. In the U.S., you can contact your local poison control center at 1-800-222-1222. In Canada, you can call a provincial poison control center for assistance. Laxatives like Dulcolax Suppository, Rectal should only be used temporarily if needed for constipation. Using high doses or using it frequently can lead to ongoing constipation and dependence on laxatives. It's important to follow the recommended dosage and use it only when necessary. The best time to use this is usually at bedtime, as it typically produces a bowel movement within 15 to 60 minutes. It's important to consult a healthcare professional for the correct dosage and timing for your specific situation. When using Dulcolax Suppository, it is inserted into the rectum and works by increasing the amount of water in the stool, making it softer and easier to pass. This medication is used to treat occasional constipation and to clean the bowels before certain medical procedures. It is important to follow the dosage instructions provided by your doctor or pharmacist. Typically, adults and children 12 years and older can use one suppository a day, while children 6 to 12 years old can use half a suppository a day. It is best to use this medication at bedtime or as directed by your doctor. Be sure to drink plenty of fluids while using this medication and avoid lying down for at least 10 minutes after using the suppository. Always consult with your doctor before using this medication, especially if you have any medical conditions or are taking other medications. When it comes to storing Dulcolax Suppository, Rectal, make sure to check the package label for specific instructions. It's important to keep it away from heat, direct light, and moisture, so avoid storing it in the bathroom. And of course, always keep it out of reach of children and pets. When it comes to getting rid of any unused or expired medication, it's important to do so properly. Instead of flushing it down the toilet or pouring it into a drain, consult your pharmacist or local waste disposal company for the best way to discard it. This not only helps protect the environment, but also ensures the safe disposal of the medication. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.